Good afternoon. In this demo, we're going to show you how to set up Telus Health with OptiStore ONE. To get started, click on Users Tools, Employee Records, and then External Resources. This will allow us to set up the system. If you're not already registered with Telus Health, click the button here, Not Registered. I'm going to assume you're registered for this demo, and what we're going to do next is click on Register Organization, and we're going to fill in all the details that you have. Normally, Telus will give you a username and password, the one that you enter on their website. That's the same username and password that you would place here. Another key thing to keep in mind is, are you an independent professional or an optical store? So usually an independent professional is someone who's like a practitioner who works maybe like a mobile optician, or you're just a single optometrist. For the most part, people are optical stores. So we fill in all the details and then just click on Save when you're done. The next thing you're going to do is register some users. So the system has different types of users. So if you have a doctor who's going to be making claims to your organization, they're part of your organization, you're going to set them up. If not, you just have an optician, and only optician, you're going to click that. So optician, choose what optician you want to use for the system. So I'm going to use Sandra. And we're going to have to say what association they're from. So we have a list of associations. You're going to pick the one that they belong to, as well as their license number, and again, once again, provider and username and password. The first screen, which asks for username and password, is mainly for anyone who's just a simple salesperson and doing data entry. If they're not set up as one of the users in the system, by default, it's going to take that username and password. So you should enter users as many as you can if they have unique IDs. If they don't have it, don't worry, they're going to use the default one we've seen on that first page. And the next we're going to click on Save. I'm going to cancel because we're done. And a couple of things you want to do if you already have a system set up from us from before, um, you're going to want to fix your inventory to be compatible with Telus. So we're going to click on Fix Lenses. So there's certain type of things which we're missing. So if there's something which the system kind of doesn't really know exactly what type of lens it is, you're going to have a list of things here. And let's suppose it was a single vision. We didn't say that it's single vision. We just simply entered it as inventory. So we would highlight that item, would specify that it's a single vision, and then just click the extended type button. We'll also have to fix certain lens options. So some options are not covered by insurance. So we have some examples here. So let's suppose you had this high luster polish. Well, that is not something that's covered by insurance. So you'll have to see, does it belong to one of the categories on the right? If it does, then you just select that and then set extended type. And that's all there is to that. So once we've done that, we can click away from this. And we're now ready to start placing orders. So let's work on that step. All right, to place an order, we're going to place an order as we normally would. So I'm going to click on place an order. I'm going to search for a customer. I'm just going to use test as an example here. And I'm going to highlight their name, place an order. And I'm going to pick some lenses. Let's do some single vision. And let's say they want a frame. And let's suppose we have a lab tray number. Are we okay with this total? Let's suppose we're fine with that. Payment history. Now what we're going to do here in payment history is slightly different than what you're used to. Instead of selecting MasterCard, Visa, American Express, or leaving as auto detect to talk to your payment terminal, you may have noticed it already selected SYNUP. This is a brand of insurance that this customer already has on file. And because they have insurance on file, it has automatically selected their insurance type from the list. All right? If they didn't have any insurance on file, you would know that because it would say auto detect, the first entry here. Now, let's suppose it said auto detect. What you could do is you could click the insurance button and fill in the details for the customer as necessary. So just fill in all these fields. Okay, they're a primary holder. Then click on add policy when you're done. And once you've done that, you can now add the payment. Now I'm going to submit everything to the insurance company. This customer may, for example, only be covered by $200, but I'm going to submit everything for now. And whatever they're covered for, is going to be used to the maximum, and the remaining balance will come back as a balance. So I'm going to show you that in a sec. So I'm going to submit the whole payment, and I'm going to click on our eClaims button. And here's our eClaims ready to go. Now let's take a look at this. Some insurance companies allow what's called predetermination, some don't. So if they do allow it, you'll see the check marks here. These are all the services that this payment provider allows, okay? This payment provider also allows to determine where the money is going to be paid, to the store or to the customer. So usually if you're using eClaims, you want it to be sent to the store. So I'm going to leave it at store as it is. Now, if I want to do a predetermination, I can go ahead and click this button, predetermination, and it would submit a predetermination to Telus. It will say what I was covered for if I was a patient, and it's not going to do any financial transactions, only going to give you an idea what the patient was covered for. There is no financial obligation in respect to predetermination. But I want to go ahead and submit this claim as it is. I'm not going to do predetermination. So if I want to submit the claim, I click the Submit Claim button. We're going to be asked, hey, is this an accident or was this a regular claim? If it's an accident, you're going to choose what type of accident and the date. But I'm going to say no because it's not an accident. Here's our legal terms and conditions we have to abide. So I agree. Click on OK. So let's give it a sec. And here we go. This is our coverage. So we can see we submitted $393 originally, but the coverage is only $344.30. So the customer will have to pay this balance here. All right, we can scroll down and get a little description as to why that number came to be of 344.30. And here's an explanation. So for example, here's our frame. This is the code that the insurance company uses. This is what was submitted, and this is what they're eligible for. So you'll have a breakdown here. You have an idea what the coverage was. In addition to that, um, uh, you have an explanation for all of this, so we can view our attachment. And this will explain the entire coverage. And this is what you're used to seeing, the PDF file that you get off of the portal. This is the exact same explanation of benefits. Because this is a demo, it says Canada Life. We are using SynUp. You will get the correct name. But you get the basic idea. This is the explanation. This is what you would print off and hand to your patient. So we're going to go ahead. We can print that if we want. I'm going to close this thing down. And I'm going to close this window because we're done. Now, as remember, there is a balance to be paid. So we're going to ask the customer, do you want to pay it now or do you want to pay it when you come pick up your glasses? I'm going to leave it now just as this amount to be paid. And I'm just going to close this window and click on done. And there you have it. This is how you make submit a claim to Telus, and this is how you get paid. If you have any questions or comments, feel free to reach out to us. Thank you.